Hi there, this is Dr. Evan Osar with Integrative Movement Institute. Happy Thursday. Hope you're having a great week and you're getting ready for the weekend and educating and empowering your clients. How many clients do you work with that actually have a forward shoulder position that creates shoulder issues, limited range of motion, as well as maybe changes in neck rotation or neck motion, or changes in breathing? Well, if you have clients just like the clients we have and work with in our office, you have lots of clients that have issues with their pectoralis minor. So on Two Anatomy Geeks, this series, we're talking about the nervous system and the nervous system's impact on the myofascial system. Because remember, the nervous system controls all. It decides, it takes in information, and then it creates an output. And if the output or the information it's receiving is faulty, so to speak, well then the output will be somewhat faulty as well. Or I should say, not so much faulty, but suboptimal. Not as optimal as it could be. So what would make the pectoralis minor, what would make your nervous system make the pectoralis minor short and tight? Well, let's think about the origin and the insertion or the attachments of the pectoralis minor. Well, if you stick your finger right in front of this bone right here, so the coracoid process of the scapula, that's the proximal attachment of the pectoralis minor. And then if you think about it, or I should say, then the pectoralis minor has three slips of muscles that come down to ribs 3 through 5. So in an ideal or optimal position with the scapula, I should say, what it does to the scapula is it helps stabilize the scapula so that when you go into upward rotation, or I should say overhead reaching, you're going into overhead reaching, it's limiting how far the scapula is sliding back on the rib cage. If you're reaching behind you like that, well then it's shortening down to allow that anterior tilt of the scapula. What else does it do? Because it's got another important function besides just movement of the scapula. When the scapula is in a nice stable position, what the pectoralis minor is responsible for is elevating the ribs as you take a deep breath in. One of the issues that arises for so many of our clients that actually shorten this down, let me give you two reasons why the pectoralis minor shortens down, why the nervous system will shorten the pectoralis minor. Number one is if your client has been cued or is just overusing shoulder compression and depression as their stabilization strategy. So put your fingers right here. So find your coracoid process, that bone right here in front of your shoulder. You can oftentimes feel a ropey pec minor or trigger points in that pectoralis minor. Now squeeze down and back. What happens to that pectoralis minor? It actually gets shorter and tighter for most individuals. So then we have to ask ourselves, is that the most appropriate cue? Because that cue is actually perpetuating the shoulder issues it's trying to solve, okay? Hello, Mary Trella, how are you? Mary Trella is gonna put the link next to the Two Anatomy Geeks series below this video. Actually, it's in this video, but she'll also put it wherever you're watching it as well. Now, the other thing that will make pectoralis minor short and overactive is when you're not using an optimal breathing strategy, meaning you're not using the diaphragm appropriately and you're not using your entire cylinder, your thoracopelvic cylinder appropriately in breathing or during breathing, well then the pectoralis minor becomes shorter and tighter because it's trying to elevate that rib cage. And that's the problem with short, shallow, rapid breathing. It's making the pectoralis minor work faster, harder, and more than it should. Well, sooner or later, it's going to get stronger and more active and more taut, and it will also pull the shoulder forward. So now you have the combined issue of the rib cage being elevated, the shoulder being pulled forward, and now the shoulder stuck in this position, and now your client has impingement syndrome or lack of range of motion and impingement syndrome and or issues like thoracic outlet, nerve impingement, and all those issues associated with a forward shoulder, forward head position. So how do you actively, successfully address a short pec minor? Well, one of the things that does not work, or rarely works, I should say, sometimes it works, but rarely, just trying to do a stretch like that rarely works. Because what happens is, if you watch most of your clients stretching, they're trying to stretch their pecs and or pec minors, really what they need to be lengthening and stretching, they're basically going like this. So basically, if you look at my shoulder, it's just still going forward, and they're not actually getting length in their pectoralis minor. So you have to do something that brings the pectoralis minor back this direction, and then the arm back this direction. Very few people are stretching that way. Hello, Pete Rislow. How are you, my friend? My best friend from back home in NJ. So you have to do something to release the pec minor. Now, the most effective way we have found is with a tool like this. This is actually the mini Rolga from Rolga. You don't need this tool. You just need any tool. You can even use your fingers if you don't have this tool. So basically what you're going to do is place this tool. So we like this tool because it's firm, it's soft. I should say not soft, it's firm. It's not firm and soft. It's firm and it's easy to grasp. So even your clients that have finger issues or issues with their hand or wrist, they can grab it pretty easily, and now they can use it as a trigger point tool. Now the tool is not, or the goal is not to dig and push and prod and do all this crazy stuff that we've all been taught. I'm a chiropractor, went through massage school as well, been to tons of trigger point, myofascial therapy classes. I've been taught to dig and push and pull and prod. The most effective way is to allow your nervous system to do the work for you. Remember, this muscle is overactive in breathing and or shoulder stabilization. So you have to teach the brain that to let it go. So this is how it works, super easy. Take your device, stick it right in the pectoralis minor. So right where you palpated it, stick it right there, shorten down pectoralis minor. Make it even shorter. Hold that for a count of 5, 4, 3, 2, 1. Take a deep breath in. And as you breathe out, gently lengthen and widen the shoulder. So if you notice, my shoulder is going that way, up and back, because the pectoralis minor is doing what? It's pulling it down and forward and compressing it or depressing the shoulder complex. So when we lengthen it, we need to go up and out, or up and wide that way. So from here, it's shorten, just apply a little pressure, and really all the pressure is doing is doing a little bit of compression, because actually a great research article came out in the last couple of years that showed that what actually releases a trigger point is not you pushing on it, or I should say it is you pushing on it. It's the vasoconstriction that happens when you push on it, and then when you release it, it releases actually nitric oxide, which is a vasodilator, so you get a perfusion of blood to the area, and hence better vascular flow to the area, and then the muscle tends to relax. So that's one of the proposed theories of why this works. So again, shorten, hold for 5, 4, 3, 2, 1. Take a deep breath in, and then as you breathe out, go wide. Allow the shoulder to go out, wide, and slightly up. So it's wide and slightly up. That's how you start to create that width through the front of the shoulder. That's what you want. That's what you need to get the shoulder to come up and overhead. And just those couple of little breaths actually just made my shoulder feel easier to get up overhead. So that's actually really good range of motion for me. Now, you've done your myofascial release. You still have to teach your brain how to create a more optimal stabilization strategy. Because what it knows how to do, or what it remembers how to do, the habit it's created is to shorten it down every time you do some exercises, rows and or pushes or pulls, right? So we have to do something now to teach it how to be in a more lengthened position. So let me grab my band real quick here. Got my band right here. So a simple, easy pattern we created for our clients and for ourselves. This actually made a huge difference when I was first addressing rotator cuff tears and labral tears in both my shoulders, is the band pull apart. So basically you take a band, light band. Lighter, the better. In fact, we teach our clients to start with a towel. You don't even need a band. It's more the movement, I should say the position, the setup, and the position. Grab it a little bit wider than shoulder width apart, turn your palms so your palms are facing in. Now bring your thumbs back to the shoulders. So it looks like this from the side. So arms are out, slightly wider than the shoulder. Pull back this direction. Now you've got the wide shoulder position. You're gonna breathe in. As you breathe out, bring it right to about here, just the top of the forehead. Breathe in, breathe out. And you can elongate the expiration. So breathe in and breathe out. Hold that. Breathe in, breathe out. You're also encouraging your client to breathe through their thoraco-pelvic cylinder, using a better or more optimal diaphragmatic breathing strategy. You're always using the diaphragm. You usually want to encourage them to use it in a more optimal manner and use less of their accessory muscles. Last time, breathe in, breathe out. and then relax. Now, if you checked your range of motion before and after, so I did, and that's even easier. So the range is better, and the ease of motion is important too, because it helps your client develop interoception, or that internal awareness of their body, what's happening in their body and their movement. So now my shoulder flexion feels awesome, and it feels light and easy to get my arm overhead as compared to what it did earlier today. So I hope that made sense. Pectoralis minor, super important muscle to stabilize the shoulder as well as to assist breathing. When it becomes short and overactive, the nervous system makes it short and overactive because other things aren't stabilizing the shoulder and or your breathing is suboptimal. Now you need a corrective exercise strategy to help your client create a more optimal strategy for stabilizing the shoulder as well as for breathing. First, you do the release to allow you to get into a better position. Then you use a stabilization pattern like the band pull apart and pull over, and then you reinforce it with a functional integration motion. It could be a supported wall hip hinge. It could be something on the floor, a quadruped position. It could be a row or any functional integration pattern that teaches you to now use that range of motion, use that more optimal position, so that way you can help your client develop more optimal alignment and motor control, and then functionally integrate it into their patterns that they need for everyday life. And that's how you become a go-to specialist in your area, differentiate yourself, and help more individuals with chronic shoulder, neck, and upper back issues. If you like that and want to learn some more, this Saturday is part 2 of our 3-part series of 2 Anatomy Geeks. No worries if you missed the first part. For part 1, basically gave an introduction, overview of the nervous system, and we gave you some strategies or some thought processes of muscle contraction, as well as this idea of what happens when the nervous system becomes or gets altered messages and altered outputs. This week here, we're discussing myofascial trigger points and its relationship or their relationship to the central nervous system, and then how to use strategies just like I shared with you here today to help your clients address chronic myofascial trigger points as well as chronic tightness. In part 3, next Saturday, we're going to continue this discussion and talk about 2 common issues impacting the nerves coming out of the neck: thoracic outlet syndrome, which is very common with a tight, short pectoralis minor, as well as sciatica, and why so many of your clients have sciatica and the nerves that are coming out of the low back down the legs. So we want to tie this anatomy knowledge, this brand new anatomy knowledge that you're gaining, into functional application, because it's great to learn anatomy. If you're an anatomy geek like us, you're going to geek out with this information. And more importantly, or as importantly, we want you to be able to apply it to your clients so that you can help them solve their chronic issues. So you help train them in a safer and more effective manner so that you can help them even when they have failed, maybe physical therapy or chiropractic, and or just are dealing with chronic issues. Like a client I was working with last night who had this exact problem. She had a degenerated shoulder, she has a degenerated neck, she's got this chronic radicular pain, nerve pain down her arm. She had surgery on her shoulder, and now we're using these same ideas to help her get her shoulder back, even when she failed conventional physical therapy. So I know the strategy works. It's worked for my own shoulders. It's the same things I teach to my patients as well. So we'd love to have you join us. All sessions are recorded, so if you did miss part 1 of the series, you can get immediate access to that. Watch that. It's about 90 minutes in length. So, and then we'll see you this Saturday. It'll be another 90 minutes, but generally speaking, we get closer to 2 hours with it because we just geek out on this information, Jill and I, my fellow anatomy geek. Link is in this video or wherever you're watching it. We look forward to seeing you. Thank you for all you do for your community. Make it a great weekend, and we look forward to seeing you on 2 Anatomy Geeks. Take care. This is Dr. Evan Osar with Integrative Movement Insider and one of the 2 Anatomy Geeks. Take care.